Good morning. My name is Katie. I'm going to be the student nurse performing your abdominal dressing change today. Here's my instructor, Allie. It's nice to see you today. I'm just going to make sure that I've got the curtain shut, provide some privacy. I've already washed my hands, but can I just get your name and date of birth, please? Awesome, thanks so much. And I know you got some pain meds about 30 minutes ago. Could you rate your pain for me on a scale of 1 to 10 so we know that before we get started?
Patient rates pain a scale of 3 out of 10.
Phenomenal. All right, well, we'll get going on that. And we also want to make sure, do you have any allergies?
No allergies were determined.
Perfect, and there's none on your wristband, and I didn't see any in the computer either.
Wonderful. So we're going to be doing an abdominal dressing change for you today. So we'll take off the old dressing, do a little bit of irrigation, and then put a new dressing on. It is going to be a sterile procedure, so we ask that while we're doing that, try to stay as still as possible and try not to cough or sneeze. We can get you a mask if you do need to cough or sneeze, just so we keep any bacteria out of that wound while we're working. Do you have any questions on that right now? Okay. So we're just going to go gather some supplies and we'll be right back to get started on that dressing change for you.
Today I'm going to be introducing all the supplies that we're going to be using today, starting with our sterile field kit and our syringes. It's important to have tape as well, our sterile water, our surgical sponges, our surgical gloves, our abdominal pads, our bandage roll, and our cotton adapters as well.
Yep.
The nurse will remove the old dressing using clean technique.
Okay, so we're just going to take this dressing off, and then we will take a measurement of your wound before we do a new dressing. We're going to pull this out. Okay, we're just going to take a quick look and measure the size of your wound. Okay. Okay.
A Chuck's pad was placed below the patient and a syringe was filled with sterile water.
All right, so I'm just going to irrigate your injury with some sterile water before we put the new dressing on. That way there's a little bit of pressure to clean it out.
Good. Okay, Katie, we're gonna, while we have the wound open without a dressing on, we're gonna just take a look at it and assess it for any signs of infection, any eschar, granulation, any swelling, and then see if there's any tunneling or anything that we need to be aware of before we repack it.
The nurse will now don sterile gloves, prepare a sterile field, and maintain sterile technique for the remainder of the dressing change.
Okay, Katie, now that you have your sterile gloves on, we're going to start the procedure. Just be sure to keep your hands above your waist, and we're going to try not to contaminate our sterile field as we go. So first thing we're going to do is grab that bandage roll. We've put sterile water in the base with it, so it is a wet dressing now. So grab that, squeeze it out, and we're going to start packing the wound. You can use a cotton tip applicator to pack that dressing into the wound.
All right, sir, I'm going to start doing your wet to dry dressing, starting with the gauze roll here.
And as you're doing that, I want to make sure that you keep that gauze roll off the clean skin as much as possible and just in that wound so we don't contaminate it. And you're using that cotton tip applicator to really push the gauze in there to prevent any tunneling.
Oh, should there be more?
That looks really good right now. So what we're gonna do is grab the scissors and we'll cut that bandage roll off.
Okay.
You can discard the cotton applicator in the garbage. Okay, so you can discard that bandage roll, and then we'll grab our gauze pads and place those on top of the wound. Make sure to cover all the way to the edges. Perfect. Then we'll grab our abdominal pad and place that on top. This will just provide a little bit of extra cushion and protection for that wound. And now we are going to tape down the wound, and I will hand you the tape here.
So I noted the date and the time in which I performed the dressing. Anything else I need to do?
Nope, so we'll just document this in the computer. We do want to provide a little bit of education to the patient, so we will be doing these dressing changes 2 to 3 times a day, and we want to let the patient know that if he does need to cough or sneeze, we do want to hold the abdomen splint while we do that to prevent any further injury to that wound.
Awesome. So like my instructor was saying, you can use a pillow or something and kind of splint your stomach. That way if you have to cough or sneeze, you're protecting that dressing change, and you'll probably see us back in just a few hours to do another one. Alrighty, we're just gonna get you all covered up. And then are you comfortable in this position? Awesome. So we'll leave you flat. Got your side rail up. I'm actually gonna lower the bed. There we go. Would you like the lights on or off? Awesome. So I'm just gonna make sure you've got your call lights. You can give me a call if you need anything. We'll see you a little bit later.